So I decided to be a doctor actually after college. My wife has Crohn's disease and we were in a car accident after college. So we spent a lot of time with doctors since then. And during that experience, I grew to become very interested in medicine, but I also saw an opportunity to become a doctor who really has empathy with the patients, is able to connect with the patients on the human level, and therefore help with the healing process.
I wanted to become a doctor because, first of all, my family members, I had a lot of them that were elderly and went through through the health system, and I saw that how much they were suffering, and also in the other sense that how wonderful the doctors were in helping diagnose and treating them. So I wanted to be part of that and help other people as well.
Scripps Mercy is a phenomenal place to train. The hospital cares for a whole range of patients of all diverse backgrounds and the underserved. Our residents enjoy working with each other and care for each other. Our faculty loves to teach, and the residents develop strong positive relationships with the faculty.
Scripps Mercy is a wonderful place to do your residency. We have a really tightly knit, collaborative group that works closely together. The clinical training is excellent here at Scripps Mercy. We have the busiest emergency department in all of San Diego, and so residents get a wealth of clinical experience that translates into becoming fine physicians. Additionally, we have just amazing lectures and didactics here where they can learn the facts of internal medicine.
I chose Scripps for my residency training because it has an excellent academic aspect of the training with wonderful teaching from the attendings. It also has an extremely happy atmosphere. I noticed when I visited that the residents were happy, the staff is happy, the attendings are wonderfully happy and take good care of us.
The perfect candidate for Scripps Mercy is the physician in training that wants to learn how to be an outstanding physician and is dedicated to wanting to become the best doctor they possibly can. There's someone who's going to be warm, who's going to be friendly, who's going to be a great team player, and is highly professional. Those are the types of candidates that we're looking for.
The Scripps program is very special because of the camaraderie that we see between the attendings, the co-residents, but also between the nurses and the techs and the pharmacists. It just feels like a family. It's a very welcoming environment.
This program is really special because of the people. People come to Scripps Mercy and they don't want to leave because it's such an amazing place. It's just a warm, friendly community. Everyone has a heart for taking care of patients and providing outstanding care for our patients. One thing that really makes Mercy unique is the handheld ultrasound program that we have that is by far the best in the country. This program was started by Dr. Bruce Kumura 15 years ago, and he's poured his heart and soul into this program. And by the time that you graduate, as a matter of fact, by the time you finish your internship year, you'll be able to carry your own handheld ultrasound device with you to help evaluate patients.
For me, what's really special about working at Scripps Mercy is the mission to take care of everybody who walks through the door, whether they're affluent or completely homeless. It's the culture of compassion that goes into everything here. It really feels like family here at Scripps.
We have morning report every day from 11:30 to 12:30 where we discuss challenging cases. Then we have noon conference for an hour after that, given by outstanding faculty in their fields of expertise. And then we have grand rounds every Tuesday morning given by a national expert in one area or another. So Mercy also offers a wonderful opportunity to do research. Every May we have a 4-week research competition where residents present the research that they have done during this past year. They both present case reports as well as original scientific investigations. This past year we had over 30 different presentations by residents, and so research is a very important part of our community. Residents have also presented at both local and national conferences and won awards at these conferences. So a typical day for a resident varies on what rotation that they're doing. If they're on the medicine wards, for example, they might come to work at 6:30 and pre-round on their group of 6 or 7 or 8 patients. They'll meet at 8 o'clock with their attending physician, who will go to the patient rooms with the intern and examine the patient and do rounds at that point. Then residents have some time to get their work done between 10 and 11:30. And then at 11:30 is when our conferences start. 11:30 to 12:30 is our morning report time, where we talk about a really interesting case. And then 12:30 to 1:30 is when an excellent lecture takes place. In the afternoon, a resident will have time to evaluate patients, finish their documentation, and sign out usually by between 4:30 and 5 o'clock on a not so busy day, so they can enjoy the beauty of San Diego.
Right now I'm actually on my wards rotation, so my day usually starts with arriving at the hospital between 6:30 and 7. I will learn about overnight patients that came into my team from the overnight residents. At that point, I'll meet with my interns and the rest of my team. I'll go off and see patients in the morning, prepare. We present to our attending in the morning and discuss any patients. The thing that I really like after that is we go to what are called MDR rounds, where we meet with the rest of the support staff, the case managers, the physical therapist, the nursing, and we're able to discuss all the issues going on with the patient very efficiently right there in the morning. The rest of the day we spend taking new admissions, seeing our patients further, and taking care of the rest of our work. And then we actually sign out each day at around 4:30.
Mercy Hospital is one of the most diverse hospitals that you'll ever see. 2 years ago, we used our translator phone for over 100 different languages. Because of our proximity to the border, we see lots of patients with diverse backgrounds, and we see lots of interesting infectious disease and other diseases that you won't see at other hospitals with less diversity. We're also a place that's incredibly socioeconomically diverse. Our main mission is we do take care of the underserved, but we also have patients on our service with excellent insurance, and patients that come in on cruise ships and have a fainting spell, and so we take care of patients from all different ends of the spectrum.
What I think is really special about working in San Diego is that we're right next to the border. There's a huge diversity of backgrounds in what we see, and we get to see a lot of strange and challenging cases coming into the hospital that you rarely would see elsewhere in the U.S.
Scripps Mercy has been characterized by both the Joint Commission and the Accreditation Council on Graduate Medical Education as a hospital with heart. That's really true. Everybody here really cares for each other. The doctors, the residents, the nurses, administration, and everyone really cares for our patients. So it's really not just a job, it's a calling.
Scripps Mercy has been called the hospital with heart because of the family atmosphere that we have here. Everybody has a common goal. It's to take care of the patient and to get them safely discharged. And that's why everybody is super friendly with each other and feels like a family here.
We do what's best for patients, and we place our patients first. Part of being the place with a heart is also taking care of each other and making sure that you're a closely knit and collaborative community.
I love the culture of Scripps Mercy. It has an atmosphere that we're a family here. We're a family within our training program, with the attendings and the staff really caring about us and feeling like a comfortable family where we can talk about whatever we need to.
Scripps Mercy prepares residents to go into the world and practice and teach and continue to do research and enjoy positions of great prestige, including department chairs and chiefs of medical staffs, and be real leaders in their communities.
When you're finished with your training at Scripps Mercy Hospital, you are well prepared to start your first job or to go into fellowship training. The faculty at Scripps Mercy Hospital have all been here many years. They're well connected in the community, and they can get residents jobs. every resident that has graduated here that has wanted a position in primary care or hospitalist medicine over the last 10 years, we have helped them find a position. We also have a fantastic fellowship match rate. The reason is because there's lots of research opportunities, so people will leave here with a resume that's filled with research publications. We're also very well respected by other fellowships across the country. And in addition, we allow residents to do out-rotations, and so they can spend a month at a fellowship program to see if that's a good fit for them, where the fellowship program gets to know them and they get to know the fellowship. Mercy Hospital produces great leaders. We have several graduates that are head of departments at prestigious academic centers across the country. I want them to walk out after they graduate feeling like they are really well-trained physicians ready to begin their practice. And over the 15 years that I've been here, that's the case every single time. When residents graduate, they feel like they are ready for training because of the excellent education that they've received here at Scripps Mercy Hospital.
Doing residency in San Diego is fantastic because you get all this diverse population. You see a lot of underserved people, including the homeless and the refugees. You have a lot of patients who don't have access to good medical care. We get a lot of patients also from the Imperial Valley because they don't have all the specialists there that they need, and so we see things that are end stage or something that would have been caught earlier if they had good access to primary care.
Our residents work really hard here during their clinical training, but it's such an important part of resident wellness is to have a good work-life balance, and living in San Diego is such a wonderful place to do that. San Diego is one of the few places in the country where you go skiing in the mountains, which is less than a 2-hour drive away. You can go hiking in the desert, and you could go swimming in the ocean, and you can do all three of those things on the same day.
I've learned so much academically in this program. It's wonderfully rigorous with noon conferences, morning reports, and teaching informally throughout the day from our attendings and from fellow residents. I also learned personally that I want to be a hospitalist. I love seeing the breadth of cases throughout the day, whether it's a patient with heart failure and diabetes or another patient with a challenging infection. And because the program is so strong, I really feel confident that I will be prepared to see anybody who comes in, no matter what they have.
I've learned that I would love to work in an environment like this, especially because of all the help that we get here from everyone. I definitely would like to work in a community hospital where I get to see very sick patients and help them be better.
The biggest surprise for me here at Scripps Mercy has been the benefit of having such an involved support staff. The nurses, the case managers, the physical therapists consistently go above and beyond in caring for the patient. And what I've seen that do is it really allows the ability to care for the total patient, mind, body, and spirit, and improves the outcomes.
The biggest surprise for me was when I first came here, we were still using paper charting. It definitely took a lot longer to get used to, but now that we're in Epic, it's very easy to maneuver, for patients to see their own charting, for us to see everything that happened with the patient, for other specialists as well to see what's happening with their patient as well, which not every program and not every hospital is on Epic.
One of the most memorable moments was seeing a patient that I had taken care of in the hospital, worked very hard to bring back from the brink. And he appreciated our connection so much that he wanted to follow up with me as his primary care doctor. So I got to see him about a month later in clinic, healthy again, doing well and thriving, which really brought home the importance of what we do here in the hospital.
When one of my patients was discharged from the ICU, and then I saw them on the floor as well, and I was able to discharge her to home, and it was a great feeling because you see that continuity of care when you do ICU 1 month and then next month you're on the floor. It's just a good, satisfying moment.
Really think about what the culture is of the program that you want. Does that fit with your core beliefs and what kind of a doctor you want to be? For me, that culture is here in taking care of everybody and going the extra step to treat the whole patient, mind, body, soul, to really improve their care.
Scripps Mercy's hospital is amazing because of our staff and our friendly environment. So I would definitely choose this program over again if I had to.
Mercy Hospital is a wonderful place to do your training. I've been here for 20 years and I absolutely love it. It's a family-like atmosphere, and you will come here, you will have an enjoyable residency training experience, and you will finish a well-trained physician. It is an honor and a privilege to participate in training our next generation of physicians.
In the course of my 47 years in medicine, I've experienced the joy of taking care of patients, of continuing to learn, of doing research, and of teaching. I hope as my graduates go into the world, they experience all of that same joy, learning how to grow professionally and learning how to provide excellent care for their own patients.